Hi, I'm Kearni Warren and welcome to Health and Wellness. Today I'm speaking with Flavia Liebel, who is a registered dietitian. Flavia will be speaking to us about a serious topic, especially among American high school students. We will be speaking about eating disorders. Flavia has been a registered dietitian for over 11 years, working in therapeutic nutrition as well as corporate wellness. Flavia, can you please describe to us what a role of a dietitian plays in the treatment of eating disorders?
Absolutely. A registered dietitian is part of a treatment team. So when someone is diagnosed with an eating disorder or suspected of possibly developing one, they'll reach out to usually a therapist. Sometimes they start with a dietitian, but also a medical doctor. So we work as a therapeutic team to help somebody who is either in the throes of an active eating disorder or to help somebody who has the signs and symptoms but hasn't yet gotten to that point of a diagnosis. So a registered dietitian's job is to work very closely with a therapist, a medical doctor, and a psychiatrist to help somebody challenge their beliefs about eating and their body and their desire to be thin.
Okay. Now, what are some of the most common eating disorders that you see?
The most common is anorexia nervosa, followed probably closely by bulimia nervosa. We also have people that struggle with binge eating disorder, and there's a new subcategory called orthorexia that has been developing a lot of notoriety over the last few years, and that is a desire to eat only healthy foods. So those are probably your four top eating disorder areas.
Wow, I didn't realize. Most people know about anorexia and bulimia, but I didn't know about the
orthorexia
and
yeah
the binge eating
yes
as well.
Yep, those are both diagnosable. And then there's another category when we can't actually put somebody in one of those categories. There's a category that's eating disorder not otherwise specified. So that kind of is like, because not everybody fits very neatly into one category.
Okay, so what are some of the symptoms or signs of a person who may have an eating disorder?
Those are, they're from a nutrition standpoint is probably what I can speak to the most. Therapists or medical doctors could probably be able to give a parent or an educator some other signs and symptoms to be aware of. From a nutrition standpoint, it is usually an obsession with like changing their diet. Sometimes it really starts out as just a healthy change. Parents see their child maybe choosing less junk food and drinking less juice, and it seems like it's a healthy thing, it's an okay thing. Mm-hmm. But sometimes these diets can go horribly wrong. And so something a parent should be clued into is their child frequently skipping meals? Are they sneaking away to the bathroom after a meal? Are they very secretive about snacks? Do they hide food in their room? Are they feeling, stressed or guilty when they're kind of forced to sit with the family and eat? So these are just some signs. One huge red flag should be kind of unexpected weight loss in a child or adolescent, because in that age group, they typically don't need to be losing weight, or certainly not any dramatic amount of weight. So that should be a big red flag to a parent or a doctor or an educator.
Okay. Now, I understand that 30% of females and 16% of boys in American high schools suffer with some form of eating disorder. What are some of the common, or who is a common patient or client that comes to you for help?
Right. It used to be that a lot of people just thought this was a disease that impacted girls, especially girls in the high school or college age. And unfortunately, that is not accurate anymore. We really are seeing, I've had clients as young as 9 and 10 years old, both boys and girls, that are developing anorexia nervosa. And so it's something that we need to be very aware of. It also is really crossing kind of just all boundaries. We have African American women, Asian women, Hispanic women, and men that are suffering with this disease. And unfortunately, I don't think people look at those groups, the young children. I even have a woman as old as 70 that developed an eating disorder. So it really is a much broader range than most people appreciate. And so I think it's important to kind of know that it doesn't just fit this, the white college age girl, that we really have to look at these other populations, because the sooner we can detect an eating disorder, the better chance we have of helping that person recover.
Okay, now is there a common thread or a common reason why someone would develop eating disorder?
The most common, kind of obvious, is that drive for thinness. And again, you know, like a therapist or psychiatrist could probably give you, there's a lot of underlying reasons. Certainly in our society today, with the exposure that kids have, and you know, all ages have, to the internet and to media, there is this belief that thinner's better. And that's not accurate. And we really need to help people appreciate the diversity of bodies, that we're all different and unique, and that we don't all have to look one way, and that thinner is not better.
Now, I understand that the National Eating Disorder Association is currently working with legislation to pass a bill so that Pennsylvania schools will provide information so that children can take it home to their families. Can you speak a little bit more about this new bill that is in the works?
Yeah, I mean, I'm familiar with it, and what I can speak to is how important I think this is, that this is really about early detection. And so it is kind of sending this information to parents so that they do have kind of in their hands the signs and symptoms of what to look for and what is something that they should be concerned about and what is maybe just normal preteen adolescent behavior. So this bill will make it mandatory for the schools in Pennsylvania to send this information and then to have other resources available also if they choose. And so because of my experience with kids developing eating disorders at younger and younger ages, I'm excited that the bill is even kind of in the works and that they are making it as young as 5th grade. That, you know, again, it starts very young. And so if we know what to look for at a young age, we can really kind of, I like to say, like knock them off the path before they go down a really unhealthy road.
Okay, and because there's many different forms of eating disorders, what are some of the health risks? Do they all have the same type of health risk, or are there different health risks for someone who has been suffering from an eating disorder for a long time?
I mean, there's any number of health implications to a malnourished body. You know, so somebody suffering with anorexia nervosa is going to have different complications than somebody suffering with bulimia nervosa or binge eating disorders. So they all do have health implications. And unfortunately, the longer you struggle with the disease, the more impact it's going to have on your long-term health. So, you know, that's why it's so integral to have a medical doctor as part of this team, because we really need to be able to monitor. And again, you know, the sooner you can get somebody back into like a healthy lifestyle and not a restrictive eating or a binge purge cycle, the healthier they're going to be in the long run.
Now, as a dietitian, I know we've already discussed what your role is. Do you also provide healthy tips for eating and getting someone back into eating regularly without feeling as if they're eating unhealthy or whatever they're putting in their mouth will harm them?
You know, what I really work with my clients on the most is that there's no good and bad foods. So that it's really knowing that it's okay to occasionally have sweets and treats and not to what we call demonize them. So it's really important to not feel really guilty if you have some Christmas cookies or you have, you know, a piece of candy at Halloween. Like, these are things that they need to know are okay, and that it's all part of a balance. That it's about having, you know, a good balance of carb, protein, and fat and getting all your food groups, but you don't have to eat perfectly because perfect eating doesn't exist. So that's what I do with my clients the most, is like encourage them to just broaden their horizons in terms of what they are allowed to eat and what they're not allowed to eat. So, and then I have clients that are kind of what I like to call the diet survivors, that, you know, for them, they maybe never had a full-blown eating disorder, but they still have this belief that, you know, I can never eat this, or I will gain weight, or I can't ever be healthy if I eat these foods. So just helping them kind of tune into what their body really needs and wants is what we call an intuitive eating approach.
Okay. Well, I thank you very much for speaking with us about eating disorders. Thank you.
You're welcome.